Podcasts with CADR, the Centre for Aging and Dementia Research.
Hi everyone, I'm Kim Mepham from CADR, which is the Centre for Aging and Dementia Research. Today I'm here with Dr. Sarah Jones, and Sarah works for Public Health Wales and is a co-director for the Think Network. For those of you that don't know, Think is the Transport and Health Integrated Network. So yesterday in Wales, the roads went from 30 miles per hour to 20 miles per hour. And Sarah had a huge undertaking, a huge involvement in this project. So we just wanted to know a little bit about what's the story behind the research? Why did it all get started?
Thanks, Kim. Yes, so I've in the past done loads of work around road traffic crashes. Did some work demonstrating how speed bumps could actually reduce child pedestrian casualties. And my colleague, my sidekick in Public Health Wales, his work was very much around air pollution and how we improve air quality. And we got to talking, and you know, while speed bumps stop small children being knocked down, they're actually not great for air pollution. And we started talking about there's got to be interventions that help us address almost a holy grail, if you like, of public health concerns. So that's road traffic crashes, air quality, which of course poor air quality creates respiratory problems, respiratory disease, which places a massive burden on the NHS. And then also physical inactivity as well. And we know that physical inactivity creates massive problems for the NHS. And those three, although they don't obviously appear to be linked, actually, we know that the risk of being involved in a road traffic crash stops people walking and cycling, which are really easy ways to be active. And that then encourages car use, which creates air pollution. But the three are linked. And we started to think about whether there were interventions that could help us address this. And at the same time, the Wales Bill was being drafted, and in the draft legislation, it was proposed that Wales would have the powers to set its own speed limits, and that gave us something to think about. So actually, let's do. So we started doing a bit of reading. You know, there's an obvious gain in terms of reducing road traffic casualties. We had a look at what the evidence said in relation to air pollution, the general suggestion is that in the short term, some pollutants might go up, some pollutants might go down. So the overall effect short term is there's no detrimental effect to air pollution, but that in the longer term, because more people feel more able to walk and cycle, and you have fewer people using their cars, and improved air quality as well as this effect of encouraging walking and cycling. So what we decided to do was to sort of have a look at the data and have a bit of an estimate of what could be the benefits of turning Wales from a nation in which the default speed limit was 30 to one in which the default speed limit's 20. So this only applies to roads that were 30. And we came up with some figures, and at the same time it was clear that there was a political appetite as well for changing the speed limit. And I think we were just lucky that the research that we were doing actually hit the right moment, if you like. And it also then appeared on the political agenda, and I got to contribute to the discussions around how we would make it happen, and here we are now, and it's happened.
It has happened, it really has. There's been lots of talk about it on social media, love it or hate it, it has happened. So what were the main findings behind the research? Why did you find it necessary to actually do it?
So when you have a look at the evidence that there is for reducing the speed limit, you see that straight away there's a gain in both in crash, the risk of a casualty occurring, and then also if a casualty does occur, then it tends to be less severe than if you've got so basically, if you are hit by a car traveling at 30 miles an hour, that's not going to be good for anybody. Definitely not going to be good for a small child or an older person. If you're hit by a car at 20 miles an hour, then actually the likelihood of long-term harm or death is much lower than it was at 30. Now, none of us want to be hit by a car ever. And straight away, we can see that reducing the speed limit reduces the chance of that happening and reduces the severity of injuries when it does happen, which is actually, in this post-COVID world, really, really important, because anytime a casualty doesn't occur, that's an ambulance that's not being called, an A&E attendance that's not being needed, and a hospital bed or an operating theatre not being needed, masses of physio long term. Actually the knock-on benefits to the health service are huge. So what we wanted to do was to actually put some numbers around what we thought would happen to help people to understand what potential benefits could be, and we were able to put some numbers. So based on the 2017 to 19 casualty data, we could see that we could save up to 10 lives per year, and we could avoid a large number of I think it's 1,000 casualties, 100 severe casualties, 1,000 slight. The numbers are estimates, so they were based on 2017 to 19. Depending on which years you use, you're going to get a different outcome. And we're doing this in Wales in a much bigger way than has been done in other places before, in a much wider area. So it was important to put those estimates around it, because it helps people understand what the potential benefit is. 10 lives saved every year. In one sense, 10 sounds like a small number, but actually 10 is we don't want to see people dying on our roads. 10 is a huge number of deaths on our roads. That's a huge effect on families. That's a huge effect on the health service, and is completely avoidable. So why wouldn't we? In terms of the pollution, again, it was about trying to understand and trying to model what would happen in terms of the pollution. So the benefit of doing what we did was it gave everyone some numbers to work from. Now, we think in terms of casualties, the numbers are probably going to be low. In terms of pollution in the longer term, the numbers, the benefits are going to be low. And then we couldn't just, the data doesn't exist to do modelling of things like benefits to physical activity, benefits to community well-being, benefits to local businesses. But what we also found from reading the evidence, from doing research into 20 miles an hour, was that really unusually for public health, there doesn't appear to be a negative. So what we often find in health research is that you do something over here and you get an unintended consequence over there. We haven't found it yet with 20, and I know a lot of people are very unhappy with the idea of going slower, but that doesn't translate to a health harm, is what I'd say, because actually that knee-jerk reaction that is, I don't want to slow down. Why not? Why don't you want to slow down? Why don't you want to make it nicer for people to walk and cycle? And all those people that say, well, I agree with it by homes and schools, but that's where it is by homes and schools. It's where people walk, play, go to work, go to school, shop. That's all. We haven't turned the M420. The M4 is still the same speed limit. But it is about making the communities in which we live nicer places to live. There's a lot of people that are clearly very unhappy with having to go slower. And I guess my question is, why? Because we have a lot of deaths on our roads every year. Those deaths have a knock-on effect to families, to the NHS, to society. So my question would be, well, how many deaths is acceptable? How many people is it acceptable that die on our roads every year? And Australia recently put together a TV ad in which they ask a gentleman, they say, oh, we had this many deaths on our roads in this year, and I think it was around 200, and I think it's around 230, they say. And they say to this chap that we have 230 deaths on our roads every year. How many do you think, what number do you think is acceptable? And he says, well, he says, I don't know, maybe about 70. And the chap says, okay, well, should we have a look at what 70 people look like? And around the corner comes 70 people, at the head of which are this gentleman's family. And he stops, and he clearly gets very upset, and he says, actually, no deaths is an acceptable number of deaths on our roads. And I think this is the challenge. We've been so conditioned to believing that things that happen on our roads are accidents, and our understanding of the word accident tells us that, well, there's nothing that can be done about it. That we now accept death on our road as, oh, well, that's okay. But actually it's not. Why is death on our road any more acceptable than death from COVID or death from influenza or any of the other diseases and health conditions that we see? It's, to my mind, it's not acceptable. And actually, if lowering the speed limit not only makes the risk on our road lower, but actually makes it easier for people to stay healthier as well, then isn't that a good thing?
So how are you feeling now that your research is into fruition, it's happening, and everyone's talking about that? How does that make you feel?
Humbled, to be honest. I've worked in public health for 25 years. When I started thinking about this, I never expected to be in the position that we are today, where it's actually happened. It's an absolute privilege to be where I am, because I've worked with some wonderful people who've made this happen. There's an awful lot of people who've made this happen, and it is. It's difficult to explain how I feel, because I didn't expect to ever be a part of something that's got the potential to be so influential to the health of the public, the health of the people of Wales in the longer term. And I've suggested before in other places that potentially this could have a greater public health effect than the smoking ban. If we look at our generation and the sort of the public health changes that we've seen, the smoking ban is probably the big public health change that we've seen in recent years. Potentially this could have much greater health effects than the smoking ban, because of these much wider effects around making it easier for people to walk and cycle, making it easier for people to access local shops, increasing small business viability, reducing the burden on the NHS. These much wider benefits are really, really significant. They're really potentially huge, and it is an absolute privilege. And as I said previously, I know that there are people who disagree with it. I know that there are plenty of people that will tell me there's no evidence for this, that I don't know what I'm talking about. I can promise you I've read all the evidence. I can promise you I've examined it from every direction possible, and I promise you that there is really, really good evidence that this has got the potential to be a massive benefit for the health of the people of Wales. I wouldn't be doing my job if there wasn't.
It will be really interesting to see, maybe in a year's time, what has the impact been. Thank you so much, Sarah, for joining us
Indeed. Thanks, Kim.
Podcasts with CADR, the Centre for Aging and Dementia Research.